All
right, I have my BSI on. The scene is safe. I've checked around for any hazards for myself or for my partner or for the patient. My general impression of the patient is that he is a late teenage white male. He seems to be unconscious, kind of guarding his chest, but no obvious signs of deformities or blood or any of those things. So I'm going to go ahead and assess his level of consciousness. I'm going to have my partner go ahead and take manual stabilization of C-spine because we do see that there's a tipped over chair over there and we believe that he fell out of it. So partner has C-spine. I'm going to come up. Sir, can you hear me? No response to verbal. I'm going to pinch the traps. No response to pain. He is unconscious and unresponsive. So we are going to go ahead at this time and check his airway. I'm going to do a modified jaw thrust. There we go. I see nothing in the airway that would get in the way. No reason to suction. But because he is unresponsive and he seems to be breathing shallowly and rapidly, I'm going to go ahead and insert an OPA into his mouth. So I'm going to size that correctly, sneak that in. That's now holding his tongue down. We have a patent airway. It looks to be that his breathing is about 26 and shallow. So because of that, we're going to go ahead and have my partner put him onto a bag valve mask with 100% supplemental oxygen flowing at about 15 liters per minute, just to assist with those ventilations. We have equal rise of the chest on both sides, so that's good. Breathing is now okay. I'm going to go ahead and check circulation. Looking for a pulse. I find one. It's about 72. It is strong, so that's good. Looking for a pulse down here. Find a pulse, and it's strong as well. So now airway, breathing, circulation is good. We're going to go ahead and do a chunk check. Make sure there's no bleeding anywhere. So I'm checking behind the head, checking for blood, checking to see if there's any spinal instabilities or deformities back there. No blood here. No blood there. We do have a painful response right here. There's a little bit of blood, but nothing huge, so we're going to go ahead and keep checking. Nothing here. We do come across, this is very swollen. Seems to be a deformity as we come down. This thigh is significantly larger than this thigh, so we aren't going to palpate that too much. But I'm going to take note of that as well. No blood. Okay, so my circulation check is complete. I'm going to come back up here. I'm going to go ahead and say that because this patient needs assistance with his breathing and we seem to have obvious deformity of the leg, that seems pretty serious. I want to transport him immediately. So I'm going to get that rolling. While that's happening, I'm going to go through and perform a physical examination of him. Because I don't have any bystanders present, I can't ask anybody for a sample history. If the patient was conscious, I could do that. Unfortunately, he's not conscious, rules that out. So we're going to go ahead and do our detailed physical exam. So I'm going to check around the head again, check the forebraw, check the cheeks, check the mandible, check the maxilla. Don't see any obvious signs of battle signs or fluid coming out of his ears. No JVD, I don't see a stoma, I don't see any medic alert necklaces or anything of that sort. Clavicle is equal. Don't feel anything wrong with the shoulders or the scapula. I'm going to go ahead and feel the sternum. Nothing irregular or cracking there. We know that there's an injury right here, so I'm going to be very, very cautious of that. But I am going to come back, feel the chest. There's an obvious deformity there. I'm going to go ahead and pull out my stethoscope. I'm going to auscultate on this side to see what the lung sounds are. They seem clear. When I auscultate over here, I hear some definite crackles. And I can see a little bit of a lower chest rise on this side. So we're going to take note of that. Make sure that breathing is still okay. Come back and reassess that. Come back through. Don't feel anything there. Palpate the abdomen. Don't feel anything irregular. Push the hips together. No obvious deformities, no crackling. Don't feel anything on the legs. Patient is unconscious, so I can't ask him to push down or pull back up on my feet with his feet. We do have capillary refill and a response. So we know that there is an issue right here with the deformed leg. It seems to be swollen and that there's a fracture femur in there. It doesn't look like there's anything I can do right now. Once we are back onto the ambulance, I will try and do a traction splint and see if that relieves anything. So we're just going to go ahead, check down here. Still have a pedal pulse. There's capillary refill. And there is a response. I'm going to come back up here. Check the shoulders. No obvious deformities. We have a pulse. Cap refill. Pulse. Cap refill. Excellent. So we've now gone through our full assessment. Our chief complaints are definitely that injury on the left side of the patient's ribs and the patient's left femur. I don't see any other smaller wounds or injuries that we need to take care of. So I'm going to go ahead and go through a full set of vitals. I'm going to take his pulse, make sure that that is the same as it was at around 72 and strong. I'm going to listen to his breath sounds. Looks like he's still breathing at about 26 breaths per minute. So still going to assist him with that ventilation, and then get a blood pressure reading on him as well to make sure that the systolic is over 100. Once we've gone through that, I am going to make sure that we reassess every 5 minutes once we are on the ambulance, because this is a critical patient, and get him packaged to go.